Module 2, how to conduct a primary and secondary survey. Hi there, welcome to Module 2 of First Aid at Work on Demand. In this module we will look at how to perform a primary survey and how to complete a head-to-toe survey. When we have dealt with life-threatening emergencies such as breathing and circulatory problems, we may need to conduct a head-to-toe survey in order to determine what is wrong with our casualty, as you will see in this next video clip. When it comes to assessing a casualty, we should always carry out what is called the primary survey. These are the first steps we're going to take in trying to determine what it is that's going on with our casualty, and predominantly we're looking for life-threatening emergencies here. We can remember the primary survey by following the acronym Doctor ABC. So as you approach the scene, check for danger. Have a good look around, look above you, look in front, and look down at the floor. Have a listen in case there are moving vehicles, and even potentially have a smell. There may be toxic fumes or smoke that indicates to us that there is a problem. Having checked for danger and made sure that the area is safe, we now need to try and get a response from our casualty. So call out to them from a distance. If there's no response, then get a little bit closer to them, get down onto your knees and call into each ear and then tap them on the shoulder. What we are looking to do as we go through our response check is to determine their level of response on what we call the AVPU scale. So A stands for alert. You are responsive and you are aware of changes in your surroundings. V stands for voice. Slightly less responsive, but you do respond when I call out to you or when I ask questions. P stands for pain. Now, long gone are the days in first aid where we inflict pain on our casualties to actually get a response from them. These days, whilst it is still a pain stimulus, we're really thinking about pressure. An easy way to do this is just 2 fingers tapping them on the collarbone. If there's no response to the pain stimulus, we can now define our casualty as being unresponsive. If we have an unresponsive casualty, it's vital that we shout for help next. It might just be that we need somebody to make a phone call for us whilst we're dealing with this casualty, to go and fetch a first aid kit, or to make the area further safe if necessary. Having checked for danger and response, if we assume now that we are dealing with an unresponsive casualty, we need to think about opening the airway. So when somebody is unresponsive, and particularly if they are lay on their back, the tongue can fall to the back of the throat and block the airway. This is what's often referred to as swallowing your own tongue, although actually this is impossible without having first bitten through it. The easy way to open somebody's airway is to do what we call the head tilt chin lift maneuver. So you place the palm of your hand on the casualty's forehead, 2 fingers underneath the bony part of the chin, and you gently tilt the head back and lift the chin up towards the sky. By doing so, this stretches the tongue away from the back of the throat and allows a clear passageway for breathing to occur. Once we've opened that airway, we must hold it in that position whilst we now check for breathing. So to check for breathing, put your ear down over the casualty's mouth, look down the chest towards the feet, and count up to 10. Within that 10-second period, we are looking to ascertain, is this casualty breathing normally? Now, normal breathing should be fairly quiet, nice and rhythmic and regular. What we're not wanting to see here is any wheezing or gasping, okay, or hearing any bubbling, gurgling noises as the casualty is breathing. Typically, we'd expect to see between 2 and 5 breaths in a 10-second period. Now at this point in time, it's very, very important to make sure, is our casualty breathing normally or are they not breathing normally, because that's going to dictate very much the next steps that we take. Assuming that our casualty is actually breathing normally, then the next thing that we need to start checking is circulation. Are there any problems with the casualty's circulatory system? In essence, really what we're looking for right now is, are there any major bleeds? So have a good look around the body for any puddles of blood. And depending on what the casualty is wearing, we may need to do what we call a top-to-toe survey at this point in time. Working your way from the head all the way down to the feet, we need to check all parts of the body for any major signs of bleeding. However, be aware that all of this time we may have let go of the airway, and this could cause problems for our casualty breathing. So we need to do that circulation check as quickly as possible before then looking to put our casualty into the recovery position. Thanks for watching, and don't forget to complete the knowledge assignments before moving on to the next module.